The U.S. now down to just 2 COVID-19 vaccines. The CDC and FDA this morning recommending pausing distribution of that one-shot Johnson & Johnson vaccine. It comes after 6 people receiving the shot reported a case of a rare and severe blood clot. All of them were women between the ages of 18 and 48 with symptoms occurring 6 to 13 days after the shot. And while the suspension sounds alarming, the reactions come again from 6 out of the 6.8 million total vaccines administered. Area health officials say they are not ready to sound off on the J&J vaccine just yet. Here's KQ2's Kylie Thomas with more.
You actually have a 2 times greater chance of being struck by lightning.
Tuesday, Missouri and Kansas taking up the advice of the FDA and CDC by pausing the use of the J&J vaccine, surprising a local pharmacist as it's about a 1 in a million chance of developing a severe blood clot.
I mean, the incidence of blood clots with the J&J is very small, not that it should be taken for granted. But since there are other options to getting the vaccine, it makes sense to kind of pause it and evaluate it.
But now Rogers Pharmacy is stuck on the phones all day, calling 250 patients sitting on the J&J wait list to let them know the one-shot dose is off the table for now. And rather than switching to the Moderna vaccine, the pharmacy says most people are saving their spot in line for J&J.
Surprisingly to me anyway, a lot of people say, I'll just wait. A lot of people just like the idea of one shot. I don't want to have to come back at a specific time on a specific date and go through this again.
For those who are vaccine hesitant, this news could confirm their fears that the vaccines were developed too quickly. But regional health experts say it actually should do the opposite.
This is actually probably one of those signals again that our safety mechanisms are actually working as designed.
There are people up and awake 24 hours a day looking for these types of things to make sure that it is safe for the people receiving the vaccines in your community.
To date, Rogers Pharmacy has administered 500 shots of J&J with 0 severe side effects. Some short-term symptoms have occurred with their 2 vaccines on hand, J&J and Moderna, but again, they say nothing severe.
We've had some reactions that are typical, headache, listlessness, tiredness, that type of thing, but prolonged side effect, not really. We really haven't. I think the odds of that happening are literally 1 in a million, but to err on the side of precaution, I support it.
Reporting in St. Joseph, Kylie Thomas, KQ2 News.
If you've recently taken the single-dose J&J vaccine and suspect you may have this rare blood clot, Rogers Pharmacy saying to watch for severe headaches, leg pain, and shortness of breath. Also call your doctor, but again, health experts say this is very rare. Checking in with area health departments on their distribution of the Johnson & Johnson vaccine, the St. Joseph Health Department has not administered any in this area in their clinics. The Atchison County Health Department with 220 doses and the Tri-County Health Department with 250 doses, all reporting 0 adverse reactions so far to this single-dose shot.